Good morning, everyone. Thank you for joining PHCA today for our webinar entitled HIE Onboarding Assistance Grant Opportunity Overview. My name is Rachel Delavan. I'm the Director of Research at the Pennsylvania Healthcare Association. Before we get started, a few quick housekeeping items for webinar attendees. The webinar is being recorded today. We usually post them on our website for members to access at a later date. If you've dialed in by phone, please select telephone and enter your audio PIN in the audio panel just to eliminate echo and allow me to mute attendee lines. You can also submit questions today using the questions pane. Since we're going to keep everyone in listen-only mode for most of the webinar, you feel free to use the questions pane. We'll address them at the end, and since we have a small group, I think it would probably work at the end if we have not gotten any written questions. I will take a little time to unmute the lines of attendees and allow you to voice questions at the end and have some back and forth follow-up questions. I do have the slides from the presenters today, and I will be able to send them to you after the call. Before I turn it over to our presenters, I'd like to kick things off by offering a brief explanation of the purpose of today's webinar. Recently, PHCA was made aware of a potential grant opportunity which would assist Medicaid participating LTPAC providers with EHR systems to onboard with a health information organization, or HIO. Obviously, these connections facilitate electronic sharing of patient and resident clinical information with other providers. The very, very high-level description of the grant is that the money would be paid to the HIO selected by the LTPAC provider. The grant is intended to cover the costs of onboarding system connections, as well, I believe, as training the long-term post-acute care provider on use of the new system and connections. There are currently 4 certified HIOs in Pennsylvania, and we have one of them speaking with us today. There is a statewide public-private hub that should be linking the HIOs together in the very near future. If you haven't been to the PA eHealth Partnership Authority website, that's a great resource for updates on those future linkages. The grant requires that the provider is a Medicaid participating LTPAC provider. You'll hear a little bit more about whether the provider must have an ONC certified EHR system implemented, or whether they just have to have an EHR system when Pam talks to us in just a little bit. There are also some requirements around who you're sharing information with currently and their connection with the Medicaid EHR incentive program, and so we're going to hear a little more about that too. And the exciting part about having this webinar this morning is that all of this has been changing for the better. CMS has issued some guidance last week about state matching funds and their uses, which has actually opened up a little more flexibility in how this money, these grants, can be used. So our expert panel today includes Jim Youngkin, who is the Director of the Keystone Health Information Exchange, referred to as HIE. Jim has agreed to provide an overview of HIEs, some detail on HIE, and review the benefits of connecting a nursing facility to an HIE like HIE. Pam Zimitis will help us pull this all together and review the grant opportunity in much more detail, and also review the Medicaid EHR incentive program and the status and sort of timeline of that as we reach sort of the ending of the EHR incentive programs, at least the end of providers' ability to initiate into that program. Pam is the OMAP HIT coordinator with DHS in the Office of Medical Assistance Programs. Pam has worked really hard this week, and I'd like to thank her on getting as much clarification from CMS on their new guidance and get it as much of that worked into an update on the grant as humanly possible. And so we'll be able to follow up to the attendees on this webinar with anything additional we learn in the coming weeks. So I'd like to thank both of our presenters for joining us. I'm first going to turn it over to Jim, and once Jim is done, I'll hand control over to Pam, and then we'll take any questions from the group. So just give me a moment here, and I will switch things over to Jim.
Great. Can you see that, Rachel?
I can.
Terrific. Well, thank you for inviting me today. I'm very excited to be able to talk with this group about health information exchange and the work of the health information organizations across Pennsylvania to connect all Pennsylvanians for better care. So the good news is that the incentives are here. They've come in a number of different forms. It's not the same thing, obviously, as meaningful use, but I think the key one that nobody would dispute is the importance of care coordination to support quality care. And most of you will already know that more than 10 million Medicare beneficiaries are discharged from acute care hospitals into a variety of post-acute care settings, including long-term care hospitals, rehab, skilled nursing facilities, and patients' home with services from home health and hospice. More than 66% of these Medicare beneficiaries have 2 or more chronic conditions, and 14% have 6 or more. So the need is there from a quality perspective. Now, you may have also heard of MACRA, the Medicare Access and CHIP Reauthorization Act. It was signed last year and will take important steps towards streamlining and expanding the use of value-based payment and quality reporting programs. This is set to phase in over a number of years and will consolidate the current physician reporting programs such as the Medicare and Medicaid EHR incentive program into the merit-based incentive payment system, or MIPS. The timeline for this is pretty aggressive. As you can see, CMS's goal is by the end of 2016 to have 85% of all Medicare fee-for-service payments tied to quality or value, and then 90% of those by the end of 2018. So I'm sure you're familiar with the accountable care organizations, bundle payments for care improvement initiatives. In all of these cases, you have provider organizations going at risk and coordinating care among each other to provide the best quality of care at the lowest cost. So the need for a long-term care facility to make their information available electronically is already here because participants in these programs need to have that information available to them electronically to coordinate that care. Moving on, the 30% of all Medicare payments are expected to be some kind of alternative payment model, and then by 2018, 50% of those in an alternative payment models. So, and the big news was last week, the letter to state Medicaid directors for long-term care and behavioral health. They provided updated guidance, and that's what Pam Zamitis will be sharing later this morning. So just to orient you to the Health Information Exchange, and so you know, I refer to HIE and HIO kind of interchangeably. HIE can sometimes be referred to as a verb, the act of exchanging information, whereas a health information organization is always a noun. But basically speaking, you have these contributors, hospitals, practices, nursing home health care managers, and others in the care continuum that are publishing information, making it available through the Health Information Exchange. So they publish information in, and for the most part, they also are able to pull that information out when the patient presents for care at your facility. And you'll note at the bottom of that list, I also added patients in our Health Information Exchange as others around the country. There are many initiatives where patients can also get access to their health information through an HIE. One of the things that some of the more advanced health information organizations provide is a push service, which we call information delivery service, but it just basically allows clinicians and others who are participating in population health or value-based payments to receive information based on subscriptions. So I'll talk about that in just a second. So with HIE, the Keystone Health Information Exchange, we've been around since 2005. Went live with our first hospitals originally in 2007, and today we have 18 hospitals that are connected across the Commonwealth. You can see here primarily in central and up into the northeastern part of PA. We also have over 250 physician practices participating, and we were one of the first health information organizations in the country to also include home health and long-term care facilities. You can see we have a pretty strong footprint with all of those organizations. Some of the ones participating in HIE are chains, so they have presence across Pennsylvania and in many other states as well. Just to show that we've seen some incredible growth even just in the last year in terms of the use of the system. These are patient inquiries on a monthly basis, and you can see that we're up around between 250,000 and 300,000 patient inquiries per month. So this is the notification model. This we use for providing alerts and notifications to care managers, as well as pushing information out to members of the care team based on queries. And in this example, you have a patient who comes down to a hospital, and when they register, a message comes into the Health Information Exchange, and that allows us to push notifications out to members of that patient's care team. We do the same thing with clinical information. At the end of those visits, usually a continuity of care document or discharge summary or other type of information is also published into the exchange and gets pushed out to members of the care team if they are subscribed for that purpose. This is an overview of the patient portal, which is really nice for patients because so many today are overwhelmed with portal fatigue from getting a request to sign up for a portal at their primary care physician, and then they go to the hospital and there's a new portal, and if they have a specialist they might have one or more other portals that they have to use. With a patient portal that sits on top of the Health Information Exchange, all of that information can be aggregated and viewable and actionable for patients all in one place. We also do make that available at the patient's request to members of their family who might be able to help to coordinate their care from a distance if they're not local. One of the things that's unique to long-term and post-acute care, we found a few years ago during one of the grants we participated in that a number of the facilities in our area didn't have an electronic record. The only electronic information they had was MDS or OASIS for sending patient assessment information to CMS. So we created a tool called Transform, and we used federal funds to do this. So this is also available nationwide through the transform.keyhigh.org website. And part of our sustainability model is that there is a small fee charged for this. But basically, it will allow you to transform your MDS or OASIS information into a clinical summary document that can be published to a health information exchange. And for those of you who are privacy advocates, that Russell Robinson is a fake person. Sometimes people ask me about that. So just a quick overview of the key services that an HIE provides, in this case HIE. but most will connect the care continuum using either a provider portal or connecting EHRs directly to the exchange. They also can connect patients and family members. They can deliver reports, results, and alerts and messages. And the next stage for us, which is very exciting, is that we're also connecting statewide through the Pennsylvania Patient and Provider Network, as well as a nationwide exchange. And this means that by participating in one health information exchange, you can have access to records that are being published into other HIEs statewide and nationwide. So that's just a quick flyby on health information exchange services. And after Pam, I'll be glad to take any questions you might have.
Thanks, Jim. Pam, I'm going to turn it over to you. Just give me a second.
Great, thank you. Okay, good morning, everyone. Thank you for participating today. As mentioned, I'm Pam Salias. I'm the Office Medical Assistance Program HIT Coordinator for the state. I would, as you had heard earlier that through both of our previous speakers, that there were some changes that CMS had submitted recently that has definitely changed the scope of this project in a good way for all of you. So I have been making changes to the presentation frequently, and I believe at this point that these are as up to date as possible. They don't have the nice graphics that Jim's presentation does, but it has the information, so I'm going to go through this. I wanted to just start and give you a little bit of background about the EHR incentive program, as I think as we move forward it might help explain or help understand the whole grant program. Our incentive program began in June of 2011, and it was designed to provide incentives, to give incentives to providers who implement and then meaningfully use certified EHR systems. Our overall program is funded by, federally funded at 90% funds and 10% state match, but the incentive payments that we make are 100% federal funds. For the medical assistance EHR incentive program, we have eligible professional types, and I believe for the purpose of this presentation, the majority of those would be MDs, DOs, and CRNPs. To participate in our program, you would need to have 30% medical assistant patient volume for a 90-day period and be in the process of either using a certified system, or you could be in the process of updating to a certified system, and that would still count. For eligible professionals, you have the option to receive up to 6 years of payments that would total $63,750. This just gives you a real brief summary of the payments that we have made since our inception, and the money that we have been able to provide at that time. So we've been very successful. We do have, just to give you an idea, for 2014, numbers look a little low. We still have a significant number that we're still reviewing and in the process, so that number will increase. And then also I wanted to mention, for anybody that is interested in participating in the EHR incentive program, the way the final rule was written when it was first released is for the Medicaid EHR incentive program, the last year providers can start to participate in the program is program year 2016. So it's the program year that we're in right now. As long as you participate for the first time, now our program does sunset in 2021, but for those providers that start participation now and would attest and complete an application to receive a payment every year for the next 6 years, you could still have the opportunity to receive 6 years of payments. Our program also is designed that if a provider attests now and they're in the process of upgrading to a system, but say for next year they really didn't, the system wasn't upgraded, they weren't ready to be able to meet the meaningful use requirements at that time, they can skip a year. You don't miss that payment, or you just don't get it that year, but then you can come back for the next year for the payment. So if you are interested in participating for program year 15 or 16 now, you have until March 31st of next year to begin participating. As some of you may have heard, back in January there was an article released. It was the CMS chief, Andy Slavitt, had made a statement that meaningful use was going away in 2016. As you can imagine, that because meaningful use is a big part of our incentive program, that caused a lot of questions and confusion. So we had reached out to CMS for confirmation, us understanding that meaningful use is not going away, but we wanted them to provide that recognition and acknowledgement. And actually, Jim had mentioned earlier the MACRA. So as you can see from their response, meaningful use is not going away. The Medicare EHR incentive piece is changing a little bit. It's still available. We're still going to be proceeding as we had planned through 2021. And then the primary purpose of our call is the onboarding grant opportunity. Because our program is federally funded, we reach out to CMS every year for our funding requests for the year and request funding for a variety of projects that would help providers meet meaningful use and help health information exchange. The year that we're in now, one of our projects was the long-term post-acute care onboarding grant. And this grant provides funding to the health information organizations such as JIM to onboard long-term and post-acute care facilities to an HIO. Currently, there are 3 active HIOs onboarding facilities at this time for the grant. And Jim went through a lot of the details. Mine is very brief here just to give you an idea of the benefits. Jim definitely hit the benefits, highlighted them much better than I did. One of the things that they had mentioned with the CMS guidance that just came out, the way the grant was written in our current funding request, the request listed that providers had to participate in our EHR incentive program in order to be able to participate in the grant funding. As CMS is now highlighting and encouraging long-term post-acute care and behavioral health providers to participate in health information exchange, their guidance allows us to remove that language from our IAPD to be able to still provide the onboarding grant, but the requirement to participate in our incentive program is no longer going to be a requirement. So as of even late yesterday, my guidance was that we were going to send an update to our current funding to edit and adjust that language to remove that requirement so that it opens up and allows more long-term post-acute care facilities to participate in the onboarding grant. So once we get that to CMS and they can approve it, and I'm hoping that that does not take long. In the meantime, we can still continue to move forward, but I just wanted to share that change. So if this is something that would interest you and you're interested in the grant opportunity, you would first want to choose the HIO you want to work with. You can see here there is a link on the Pennsylvania eHealth Partnership Authority's website. It does give a breakdown, and you'll see it's a chart that describes the different HIOs. It would have contact information and everything there, and Jim, I think, provided his contact information in his presentation. Then the HIO would work with the authority to request the grant and to move forward with that. Our funding request is good through September 30th, 16. We may be able to extend that because of the guidance that just came out from CMS and add it into our next year's grant, and that's what our hope is because of this change. But as of now, it is good through the end of September, and we are hoping, given the time frame and that it takes to get onboarded and make sure that you do receive this funding for this opportunity, we are trying to get everybody to at least start the process by the end of April. And then for this, another project we have, another grant opportunity we have is the long-term post-acute care portal grant opportunity. This is very similar. You would still have access to the HIO and the information and the benefits that Jim was sharing. The difference being that you wouldn't actually go through your EHR, and it would be more of a portal grant. So should you reach out and be interested in the grant opportunity, and they may say that the system you're using, you aren't able to do the onboarding piece, it would open, though, should open and give you the opportunity to do the portal grant. This is something you would work with the HIOs on. Again, it's very similar to the onboarding grant. It's just the difference of your EHR and the portal. And again, you would want to reach out to the HIOs about that. And then just to highlight again, if you are interested in participating in our incentive program, again, it's not going to be a requirement for the onboarding grant, but if you're interested and able to do that, just a couple of the highlights. You must be considered an eligible professional, and again, for I think the purposes of this group, it would be an MD or DO or CRNP. You must have medical assistant patient volume of at least 30% during a continuous 90-day period. You must be in the process of adopting, implementing, or upgrading to a certified EHR system. As we've been working with some of the long-term post-acute care organizations to encourage participation, we did discover that there were a number of facilities that did not, they had EHR systems, but they weren't certified systems. We did do some research. Here's a little bit of highlight of some of the research that Rachel and we have found too. Click Care, which I think is a common one amongst the group, they do have a certified system. It's our understanding, though, for the senior living system that that system is not certified. The contact we had spoken with stated that they are finding out from a number of different states that this has been a challenge and something that they're working toward. They understand the importance of that, so they're working toward that. It's not currently certified, though. Allscripts, I know, was one that someone had mentioned, and they definitely have a certified system. We have a lot of providers that use that system, but the long-term care is not certified. But working with them, they may be able to provide that certification too. And then Kinzer was another one we had discovered that they were not certified at this time. So that's just a couple that we had reached out and looked into. So just something to be aware of if you are interested in participating in the program. And then again, the next two slides, I'm not going to go over them in detail, but you will receive a copy of the slides, so you will have access to these links. This just gives you the first couple steps that you would need to do to participate in our incentive program. I thought it would be easier to put them down and put the information that you're going to need as you move forward if you're interested in participating, and give you the links that will help you with that as well. And by all means, we're always available to assist you if you're interested. And then lastly, I know I covered several different funding opportunities, so I just wanted to highlight those. The one would be the Medical Assistance EHR Incentive Program, which is what our program does. We went through some of the steps for that, and that's the one that would provide you with up to $63,750 for that. Then we have the Long-Term Care Onboarding Grant that would go through your EHR system, and then we have the Portal Project and grant, and both of those you would work with the HIO on. So that kind of gives you a summary of the different funding opportunities that we discussed today. And then that's all that I had right now. There's my contact and my direct line. If you have any questions for me, be more than happy to help you. And then that's what I had, Rachel.
Thanks, Pam, and thanks, Jim. Currently, there are no questions that have been submitted to me. I actually just saw one come in. Before we go to questions, I want to just clarify one piece myself, and then pose one question to Pam that's sort of also for clarification, and then we'll get to the questions. So I just wanted to make sure it was clear to everyone on the call that what the guidance from CMS was. They're not making long-term and post-acute care providers eligible providers within the EHR incentive programs that have existed for the past 5, 6 years. They are trying to make it easier for long-term and post-acute care providers to connect to an HIO. So they're not opening up a new panacea of money for long-term and post-acute care to become an eligible provider and participate in the meaningful use and get some of that funding. They are they are moving in the right direction, I think, and I think it's going to help with this grant opportunity. But Pam, since you covered the Medicaid EHR incentive program as in your slides, can you just give a little example? So say we have a nursing facility who clearly the facility themselves as a provider is not eligible for the Medicaid EHR incentive program, but say their medical director or the CRNP that works there is eligible. What would they have to do to use that eligible provider working in their system, in their facility, to get some of that funding to implement an EHR system for the facility? Does that question make sense? Because we tried to provide a guidance to members on this years ago, and I don't know that anyone was able to do it, but since we have you.
Oh, sure, absolutely. And I think there has been a lot of confusion, and I know it's been challenging for the long-term post-acute care and behavioral health and some of those provider types to participate. When they started the program, we have specific eligible professional types that can participate, and those would be like the MDs, DOs, CRMPs. We have pediatricians, certified nurse midwives are available, are eligible, and as long as you're one of those provider types that meet the other criteria, then you would have the option to participate. I think where it left out, at least for the first part, adopt, implement, and upgrade, I think where the challenges really came into play were, one, with the certified EHR systems, knowing that a lot of the long-term post-acute care systems are not certified, and without that certification, that automatically prohibits you from participating in the program. That's one of the requirements. So I think that was probably one of the pieces that prohibited providers from participating. So if that facility has an eligible professional type and has the system, or is in the process of upgrading to a system or adopting a system. So if you have, for our purposes, if you have signed a financial commitment to work with a certified EHR vendor to implement a system or adopt a system, then that counts. Even if you're not using it at the time, then that would count. We would just ask for validation of that, and you would be able to do that, and then you could use that funding toward payment of the certified system. And even if you have a system like, the one example, the Allscripts, you might have Allscripts, but the version you're using isn't upgraded to, it's not certified. If they will work with you to move to the certified version of the system, then you could use that to apply and just get the validation from the vendor to say you're in the process of receiving or moving to the certified system and allow you to come in to participate. Does that help, and does that answer your questions? I think the other steps are like those steps on one of the last two pages that I mentioned about where you would need to go to register and so forth.
Yeah, that's helpful. I want to just encourage everyone to use that program a little creatively. If they have thought of just it doesn't work for them, they're not eligible, to think through it once again as we come toward the end, and if there's a way to use it. So I think that's really helpful. We do have one question that was submitted, and I don't know, Pam and Jim, I'm going to throw it to both of you because I'm not sure who best to answer it. The question is, does the grant for onboarding cover the participating fees to join the HIOs? And I would add to that, can we clarify whether there are any ongoing fees after joining, and does it cover those?
I'm probably the one to answer that. To say from the HIO perspective, the grants are designed to cover the cost of making the connection to the health information organization. So for your EHR to be connected, and depending on so the HIO has a vendor that provides the services to make those connections, and those connections can be pretty expensive depending on the number of interfaces. We're normally talking about something in the range of $10,000 to $20,000. Hospitals are a lot more because they have a lot more interfaces, but generally speaking, those are the kinds of costs that are being covered for this. You should check with individual HIOs to see what their subscription fees may or may not be. With HIE, we have an annual subscription fee. You don't have to pay anything until your system is connected, and then the connection is based on metrics for your organization. So if you're a long-term care, like nursing home or SNF, it would be based on the number of beds that you have in your facility. So, and if you have multiple facilities, we just add up all of the beds and figure out what tier you go in. So normally those would be fees that would be your expense once the connection fees have been paid for by the grant. I hope that answers it.
Thanks, Jim. That's very helpful. And, you know, I'd throw this out to our members on the call. If there's anything PHCA as your association can do to help you gather information about the different HIOs or help you with that decision making, connect you to them. I know the eHealth Authority website is very good and has everyone's contact information and sort of a comparison of the different HIOs. I actually have that, I believe, as one of the handouts you can grab right from here from the webinar pane, but I can include that in the follow-up email. Another thing I can include maybe is some clarification on the CMS guidance that AHCA has sent out. But if you all on the call, this is a small group, but I know you're connected to a large portion of our membership, a lot of bigger companies. So, you know, after I send that follow-up email, please get back to me. We don't have an HIT committee here yet. We don't have anything like that. If you can think of other things that would be helpful that we can organize for you, that would be great. I'm sort of talking to see if there's any more questions coming in. I don't see any. So I think what we'll do at this time is I'll thank Pam and Jim once again, and if there are additional questions, they can be emailed directly to Pam and Jim. They've given their contact information in the slides that'll go out, or you can email me directly, or any of us here at PHCA, and we'll do what we can to help you with this. So thanks again, everyone, and have a great day. Enjoy this. If you're in the Northeast, enjoy this warm spell.
Great. Thank you for having us.
Thanks, Jim. Thanks, Pam.